Good afternoon. Allegheny County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department to give our weekly update on the coronavirus pandemic. And Dr. Bogan will talk about some of the cases that are going on. I'm going to talk and basically say about the vaccines. They are now available for everybody, all 16 and above, the adult population. And as the president indicated today, along with Governor Wolf, they're within 5 miles of where you live. There's going to be a vaccine that's going to be available. So we want to make sure people are availing themselves to that. We today crossed over 900,000 shots in arms that residents of Allegheny County alone have gotten. Over 565,000 of our fellow Allegheny County citizens have gotten the vaccine. That's almost 57% of the adult population, and that's really doing better than the state, better than the country as a whole. But we still have a long way to go. We still got to get to that herd immunity where everybody gets their vaccine. So now that it's open for all young people, healthy, etc., we really are going to urge you to get that vaccine. What does it mean? It means freedom. And it also protects your grandmother and your grandfather. It protects the young people who, quite frankly, right now, people under the age of 16, who aren't eligible to get vaccines because the testing hasn't been done enough, and that may come at some point. But we want to get those folks the ability to not have the exposure as well. So I've gotten the vaccine. Dr. Bogan has gotten the vaccine. My wife has gotten it, and my kids. I'm urging everybody. So if I'm getting it, I wouldn't urge everybody else to get it without doing it myself. So we do want to get as many folks vaccinated as we can. So it's available now. There are appointments at our sites, among other places, but please check, and anything we can do to get you information to show where it is, we'll go from there. So let me turn it over now to Dr. Bogan to give her weekly report. Dr. Bogan?
Thank you, County Executive, and good afternoon, and welcome back to the Allegheny County Weekly COVID Briefing. As you'll recall from last week, I had mainly bad news to share. This week, I'm pleased to report that we have some encouraging movement, but unfortunately, we still have a long way to go before I can report strictly good news. So, this is what's encouraging. Daily case counts are slowly decreasing. During the first 10 days of April, we averaged around 425 new cases a day. And over the past week, we are down to about 350 cases a day. So not where we want to be, but certainly heading in the right direction. Also encouraging, our vaccination rates continue to rise. In Allegheny County, for people 65 and older, about 84% have received at least one vaccine. And among those 50 to 64, about 54% received at least one vaccine. And that is great news. But now it's time for everyone else to get their vaccine. Governor Wolf announced last week that everyone 16 and older is eligible to get vaccinated. And I'd like to take this time to remind and encourage you to make your appointment and get your vaccine. We want to defeat this virus, and in order to do so, we need most of our community to get vaccinated soon. Moving on. This past week, we received many questions from people who wondered about college-age students and their vaccinations. With the school year ending and students returning home, many people asked, how can students who received their first vaccine while away at school get their second vaccine here at home? Certainly, everyone's encouraged to get their second dose at the same location where they got their first, but we are well positioned in Allegheny County to accommodate students who want their second doses here. The ample supply of vaccine in the county has loosened restrictions, allowing people to secure a second dose at locations other than where they received their first. So in short, we now have more vaccine appointments than people seeking vaccinations. So to all you students returning home, I encourage you to visit our COVID-19 resource page, check out locations where we're operating daily clinics, and visit as a walk-in. Just remember to bring your vaccination card to ensure you get the same vaccine as the first dose and at the right time. For college students leaving the county in the next few weeks, I strongly encourage you to get your first vaccine dose now, and if you leave before your second dose is due, to seek it wherever you are headed. Next, I'll address vaccine hesitancy. The Janssen vaccine paused after it was discovered that 6 women developed rare blood clots was certainly a setback. Simply put, it gave people who were questioning whether they wanted to get a vaccine an excuse not to get one. Don't forget why we're vaccinating in the first place. COVID-19 is a deadly virus. It has contributed to the death of nearly 2,000 Allegheny County residents in just 13 months. The US rate of death from COVID is about 60 times the rate of death from car accidents. Let's also be clear about the risks associated with the Janssen vaccine and the dangers of contracting COVID. For those in our most vulnerable age group, those 75 and older, contracting COVID is more than 78,000 times more likely to kill you than getting blood clots from the vaccine. Even among young people, the risk of getting COVID far outweighs the risk of blood clots. People aged 18 to 29 are over 200 times more likely to die from COVID than from blood clots associated with the Janssen vaccine. Of course, I don't wish to diminish the serious effects of blood clots. I only strive to reiterate that the risks of developing these blood clots is exceedingly rare, about 1 in a million. As you may recall, from the county executive and I are participating in the Moderna vaccine trial and are fully vaccinated. The science is sound, and I want all of you to be as protected as we are. For that reason, we continue to develop strategies to combat vaccine hesitancy. Among our plans are to continue to meet with trusted community leaders so that they can inform and protect people who turn to them for guidance. And as part of the community outreach, I announced last month a campaign developed by Community Advisory Board and MEE Productions, Inc., called Spreading Truth, Not COVID. The initiative provides trusted, accurate information to communities and is aimed at dispelling myths about the virus. You can go to truthnotcovid.org to learn more and find the campaign on YouTube, Facebook, Instagram, and Twitter. Again, I encourage everyone to make an appointment or just walk into one of our vaccination sites and get your vaccine. It's free and no insurance is needed. If you're under 16 or 17, if you are 16 or 17, please bring a parent with you for consent. On our county website, click on the COVID-19 resources link at the top of the page for information on our current vaccine sites and to find answers to common questions and concerns about COVID and vaccines. Lastly, my weekly reminders. Please wear a mask, socially distance, avoid large crowds, wash your hands, and get vaccinated. So thank you for your time. Please be safe and be kind.
Our first question today is from WTAE. Has Allegheny County been in contact with the state about any possible resumption of use of the Johnson & Johnson vaccine after the pause ends? And could you speak about what would any expected resumption of the rollout of the vaccine look like here in the county?
Sure. So, I think we're all waiting for the CDC Advisory Committee on Immunization Practice to give us the green light to return to the use. So we're all waiting for that across the country. If we get the go to use it again, we will use it as we had planned in populations that want it. There were a lot of people who really wanted the Johnson & Johnson vaccine because it's a one and done, and 2 weeks after you get it, you're protected. So it was being really widely received and popular, so I suspect there'll be lots of people who want it, and we'll use it in the populations where it makes most sense, and for those who desire that vaccine.
This next question is from WPXI, a similar one from WTAE. It appears in some places COVID-19 vaccine supply is catching up with demand. Are you seeing that in Allegheny County, and are there changes expected because of this?
Absolutely. As I said in my comments, we have more supply than demand right now. And at least at the County Health Department, we're really trying to match our resources of our staff to meet the demands. So I think our goal is really to bring the vaccine to people where they are and to make it as absolutely easy as possible for everyone and anyone to get a vaccine. To do that, we're making walk-up availability as are other places. We are giving second doses to those who had first out of the county and need a vaccine. And we're decreasing our large vaccination sites over the next couple of weeks and really moving into more targeted vaccine, smaller events to reach populations of people who haven't had access or would like to have something right in their neighborhood.
This next question is from WESA. Recent data analysis by the Black Equity Coalition found that the percentage of vaccinated Allegheny County residents who are Black has decreased over the past month. What do you think the cause is behind this increasing disparity, and how is the county health department addressing it?
Yeah, we need to really get back to that trusted individual. So if you've gotten your vaccine, and please talk to your friends and your family and spread the word about the safety and the effectiveness of this vaccine. These are truly remarkable vaccines. They protect people and they're really very, very safe. The county as a whole, I have data about the vaccines that we at the county health department are giving. And we are doing, I think, better with our vaccine distribution overall. About 12% of doses that we've given in the county health department have gone to Black residents, who make up about just under 13% of our county population. But we need to, as a county, really address this. And again, I don't control, the health department does not control the distribution of the vaccines to the county as a whole. We get our share, about 10% of the doses, and the rest go to other providers. So this is really a county-wide effort, not just a health department effort, and we all need to do our part to reach communities of color and those in need for vaccines. Do you want to say something?
Yeah, thank you, Dr. Bogan. And yes, I appreciate the work that the health department is doing to do that, to get 12%, and the population's a little under 12% to do that. But really, it really needs to be everybody doing. I was delighted that the Pittsburgh Courier last week, on the front this week on the front page, there talked about the Central Baptist Church providing daily walk-in vaccine appointments in the Hill District, 2200 Wiley Avenue. We also have the open clinic in McKeesport in the Mon Valley at Reverend Coleman's church. So there's opportunities, but what we really need is people who can influence others to get the vaccine, family members. I mean, that's really what it's going to come down to, knowing, and as Dr. Bogan talked about, the risk of getting COVID and having a severe issue, including death, is so much higher without the vaccine than getting the vaccine. The vaccine, you basically eliminate the fatalities that have gone on with Pfizer and Moderna. So it's the numbers are there, the science is there. We just need, and the availability is there. So we need people to take advantage of the fact. Take your family member. Take grandpap, grandma, mom, dad. Take the young person. If your mom and dad haven't gone, young person, take your mom or dad. So we need to do this as a community, and we want to protect as many people as we can.
The next question that we have is from the Tribune Review. Do you think that herd immunity to COVID-19 is an attainable goal, knowing that vaccine hesitancy still persists?
It's attainable if everyone gets their vaccine, or most people get their vaccine. What that exact number is for herd immunity, nobody knows, but the more people who get it, the more effective herd immunity will be for all of us in our community.
This next question is from WTAE. At pharmacies where supply might be outstripping demand, can the health department reallocate doses of the vaccine to other places?
So again, the health department doesn't oversee distribution of the vaccine. That is really done at the State Department of Health level. So that would really be up to the state to redistribute the vaccine and not the county health department.
This next question again is a combination of a question from both TAE and PXI. At the last briefing you mentioned the spring surge. Have you seen an increase or decrease in cases, which I think you addressed, but are we still in the fourth wave of the pandemic?
Yeah, so our case numbers have slightly decreased. They're going down very, very slowly. And again, we're at about 350 cases a day right now. That, to me, is still a large surge. I remember the day when we thought when we got to 100, that was a lot of cases. And we just, I think, all gotten comfortable that we live with this high number of cases. So yes, we're definitely in the fourth wave. It's not as big as the winter wave, but it's still a significant number of people getting sick. And I'm going to remind you that we still are reporting deaths nearly daily from COVID-19 in our community. So the numbers, again, aren't like we were seeing in December, but they're also not zero. So yeah, I think we are.
This next question is from the Tribune Review. Could you give an overview of the health department's efforts to inoculate the county's homeless population? Does the pause in the one-shot Johnson & Johnson vaccine create an added challenge on that front?
Mm-hmm. So first of all, I want to give a big shout out to the organizations that are actually doing a lot of the work to reach our homeless population. The health department, really, that's not been our focus, because we have great organizations like the Center for Inclusion Health, our federally qualified health centers, Operation Safety Net, and Pittsburgh Mercy, who really have been doing a lot of the work to reach those populations. And they were using the mRNA vaccines before Johnson & Johnson was available to reach these groups. Of course, it's nice to be able to give one vaccine and done, but they are continuing their efforts to use the mRNA vaccines, Pfizer and Moderna, to reach this population, and I'm continue to do so. So I appreciate all their work on that. I also know that the Veterans Administration, the VA, has done a really great job at reaching their homeless veterans, and so I would encourage you to talk to them about their experience using both Moderna and I don't know if they're using Moderna or Pfizer, but the mRNA vaccines and Johnson & Johnson.
And this final question is from WTAE. Is Allegheny County making progress in getting the vaccine to people who are homebound? And can you tell us how that's going?
Yeah, we are definitely, again, this is not just Allegheny County Health Department doing homebound work, but lots of organizations have been reaching the homebound. Our health plans have been working on it. Our healthcare organizations, our federally qualified health centers, community organizations, as well as the county health department. And I think we're making great progress on that. And we encourage people who need to get vaccines to reach out to their healthcare providers, their health insurers, and the health department if you need vaccine.
That was the final question. If there are any closing remarks.
Thank you, Dr. Bogan, and it does sound like good news that the cases are starting to head in the right direction, but as you indicated, we still have a long way to go. And again, now that these vaccines are available, I tell you what the vaccine really is about. It's about freedom. You know, for the last year plus, a year and a month, most of us have been afraid to go certain places because in the back of our mind, oh, what if I run into somebody that's been exposed or I could get COVID? The vaccine takes that all away. You get the vaccine, you don't have to worry about it. I know for myself, I'll go anywhere. I have no problem going anywhere right now because I'm vaccinated. My family members the same way. My parents, my kids, my wife, we now feel freedom of being able to be together and go places that we couldn't go before. So for everybody that's out there that now has the ability to do that, go get that vaccine, protect yourself and protect your family for all the things that we want to do. So let's keep getting vaccinated. Let's keep those numbers down. Keep protecting each other. And, you know, hopefully we're a month or two away from taking the masks off and getting back to normal.